In recent years, e-cigarettes and vaping devices have exploded in popularity, particularly captivating younger demographics. Initially promoted as a revolutionary, safer alternative to combustible traditional cigarettes, these sleek devices were often viewed as a promising tool for smokers aiming to quit or significantly reduce their tobacco consumption. However, this meteoric rise of vaping has unfortunately unveiled a new and profoundly serious public health concern. EVALI, which stands for e-cigarette or vaping use-associated lung injury. This alarming condition has sounded urgent warnings among global health officials, dedicated medical researchers, and the concerned public. Today, we delve into the critical details of EVALI, what it is, its primary causes, how it is diagnosed and treated, and precisely why it represents such a critical public health challenge in our modern society. What is EVALI? Understanding the vaping-related lung illness. EVALI is the acronym for e-cigarette or vaping use-associated lung injury. The condition was initially termed VAPI, or vaping-associated pulmonary illness, but the nomenclature was updated by health authorities to more accurately reflect the increasing number of severe lung illness cases directly linked to the use of e-cigarettes and vaping products. The medical community first became acutely aware of EVALI in the summer of 2019. During this period, an unexpected and alarming surge of severe lung illnesses began to be reported across the United States. What made these cases particularly frightening was that many of the affected individuals were young, otherwise healthy adults who suddenly developed debilitating respiratory symptoms after using vaping products. The novelty of the disease means that researchers are still diligently working to comprehend its full spectrum and long-term implications. Consequently, our understanding of EVALI, including its terminology and the nuances of its pathology, may continue to evolve as more scientific data becomes available. What remains unequivocally clear is that EVALI is a dangerous condition, capable of inflicting substantial and sometimes irreversible damage to the lungs, and tragically, can even lead to death. What causes EVALI? Identifying the culprits. While the precise etiological agents of EVALI are still undergoing rigorous investigation, health organizations, most notably the Centers for Disease Control and Prevention, CDC, in the United States, have identified a principal suspect, vitamin E acetate. This oily chemical substance, frequently utilized as a thickening agent or diluent in THC-containing vaping products, has been consistently detected in the bronchoalveolar lavage, BAL fluid samples collected directly from the lungs of a significant majority of EVALI patients. THC, or tetrahydrocannabinol, is the primary psychoactive compound found in cannabis. A substantial number of individuals diagnosed with EVALI reported using vaping products containing THC, often procured from informal or illicit sources such as friends, online dealers, or unlicensed dispensaries. A landmark report published by the CDC, which analyzed BL fluid samples from EVALI patients across 16 states, discovered vitamin E acetate in 48 out of 51 patient samples. Crucially, this substance was not detected in the BAL fluid of healthy control individuals. This strong epidemiological link points to vitamin E acetate as a primary causative agent in the EVALI outbreak. However, it is critical to acknowledge that vitamin E acetate may not be the sole factor responsible for all cases of EVALI. Researchers are actively investigating other components present in vaping liquids, including various flavoring chemicals, like diacetyl, known to cause popcorn lung, heavy metals leached from the heating coils, such as lead, nickel, and tin, and other potentially toxic volatile organic compounds, to determine their contributory role in the development of this lung injury. The largely unregulated nature of the e-cigarette market adds a significant layer of complexity. Unlike traditional tobacco cigarettes, which are subject to stringent federal regulations regarding ingredients and manufacturing, vaping products exhibit vast variability in their chemical composition and production quality. This absence of robust oversight makes it exceedingly difficult to definitively pinpoint all harmful agents and underscores the urgent necessity for comprehensive research and stringent regulatory frameworks in the vaping industry. Symptoms of EVALI. Recognizing the warning signs. One of the inherent challenges in promptly diagnosing EVALI is that its clinical presentation significantly overlaps with numerous other common respiratory illnesses. Patients afflicted with EVALI typically present with a constellation of symptoms, including shortness of breath, dyspnea, persistent cough, chest pain or tightness, fever and chills, nausea, vomiting and diarrhea, fatigue, headache and dizziness, rapid heartbeat, tachycardia, weight loss. Because these symptoms can closely mimic conditions such as influenza, pneumonia, bronchitis, or even COVID-19, diagnosing EVALI necessitates a meticulous evaluation of the patient's complete medical history, a thorough physical examination, and specific attention to their vaping habits. If you regularly use e-cigarettes or vaping products and begin to experience any of these symptoms, it is imperative to seek immediate medical attention. Crucially, inform your healthcare provider about your vaping history, including the types of products used and their sources, as this information is vital for an accurate and timely diagnosis, facilitating appropriate management, and preventing severe complications. How is EVALI diagnosed? The path to identification diagnosing. EVALI is not a straightforward process, as there is no single definitive diagnostic test for the condition. Instead, clinicians rely on a systematic process of exclusion and a combination of diagnostic tools. The diagnostic journey typically begins with a comprehensive assessment of your symptoms and a detailed medical and exposure history, with a particular focus on your use of e-cigarette or vaping products within the preceding 90 days. If EVALI is suspected, your physician will likely order imaging tests, such as a chest X-ray or, more commonly, a computed tomography (CT) scan of the lungs. These imaging modalities can reveal characteristic bilateral hazy infiltrates or opacities on the lungs, indicative of inflammation and tissue damage commonly observed in EVALI patients. In certain, more complex or severe cases, or when the diagnosis remains ambiguous, doctors may perform a bronchoalveolar lavage, BAL. This procedure involves instilling a small amount of sterile saline into a section of the lung via a bronchoscope, then collecting the fluid for laboratory analysis. BAL fluid can be tested for the presence of vitamin E acetate and other substances, as well as to rule out infectious causes. Given the symptomatic overlap, a critical component of diagnosing EVALI involves ruling out other potential causes of lung illness. This often includes tests for infectious agents like bacteria and viruses, e.g. influenza, COVID-19, mycoplasma pneumonia, and an evaluation for other non-infectious lung diseases. This comprehensive, albeit complex, diagnostic approach is essential to ensure an accurate diagnosis, which subsequently guides the most effective treatment strategy. Treatment for EVALI. Managing a new disease. The treatment for EVALI can be challenging due to the condition's relative novelty and its often unpredictable clinical course. Statistical data from the 2019 outbreak indicated that EVALI can be extremely severe. 96% of reported cases required hospitalization, and unfortunately, some patients succumbed to the illness. Treatment protocols are tailored to the severity of the patient's illness and typically involve a multifaceted approach combining medications and supportive care. Initially, physicians may prescribe empiric antibiotics or antiviral medications to cover potential infections while diagnostic tests are pending. Once an infectious etiology is ruled out or deemed less likely, corticosteroids, such as prednisone or methylprednisolone, are frequently administered. These powerful anti-inflammatory medications have shown considerable efficacy in reducing lung inflammation and aiding recovery in many EVALI patients, but they must be used judiciously under medical supervision due to potential side effects, For patients presenting with more severe respiratory distress, hospitalization is almost always necessary. Supportive care may include supplemental oxygen to alleviate hypoxia. In critical cases where patients experience respiratory failure and are unable to breathe adequately on their own, mechanical ventilation in an intensive care unit, ICU, may be required. The path to recovery from EVALI can be protracted and arduous. Even after discharge from the hospital, patients require diligent follow-up care. One of the most disconcerting aspects of EVALI has been the observation of patients relapsing or, in rare instances, dying shortly after hospital discharge. This underscores the critical importance of ongoing medical supervision. Health authorities strongly recommend that all EVALI patients, irrespective of the initial severity of their illness, schedule a follow-up appointment with a pulmonologist, lung specialist, within 48 hours to 1 week of discharge. Regular checkups, pulmonary function tests, and possibly repeat imaging are essential to monitor recovery, detect any lingering inflammation, and manage potential long-term complications. Pulmonary rehabilitation programs, incorporating breathing exercises and physical therapy, may also be beneficial for patients who have experienced significant lung impairment. Lingering questions, public health imperatives, and the future. Despite significant advancements in understanding EVALI since its emergence, many questions remain unanswered. For instance, why do some individuals develop severe EVALI while others using similar vaping products do not? Are there specific genetic predispositions or environmental cofactors that elevate the risk? What are the long-term consequences of EVALI on lung health and overall physiological function? These are pivotal questions that ongoing research endeavors aim to address. A paramount concern remains the profound lack of stringent regulation in the global vaping industry. Many of the products implicated in the EVALI outbreak were sourced from informal channels, with their exact ingredients often unknown, untested, or dangerously adulterated. This situation highlights an urgent, unmet need for stricter governmental regulations, comprehensive product testing, and transparent ingredient disclosure to ensure the safety of all vaping products. Until such measures are universally implemented, the most effective way to protect oneself from EVALI is to abstain from using e-cigarettes and all vaping products. It is crucial to remember that e-cigarettes and vaping devices have only been widely available for a little over a decade, and we are still in the nascent stages of understanding their long-term health effects. The EVALI outbreak served as a stark, undeniable demonstration that these products are far from innocuous, and that their use can lead to severe, life-threatening consequences. If you or someone you know uses e-cigarettes or vaping products, it is vital to be acutely aware of the potential dangers associated with these devices and to seek prompt medical evaluation if any concerning respiratory or systemic symptoms arise. For individuals currently using vaping as a method to quit smoking traditional cigarettes, it is highly advisable to explore safer, FDA-approved nicotine replacement therapies, NRTs, such as patches, gums, or lozenges, or to seek evidence-based cessation counseling and support. While vaping might appear to be a less harmful alternative to smoking, the substantial risks associated with EVALI and other yet-to-be fully understood health concerns render it a less than ideal choice for smoking cessation or recreational use. In conclusion, EVALI stands as a sobering reminder that the perceived safety of e-cigarettes and vaping products is far from guaranteed. While vitamin E acetate has been strongly implicated as a primary culprit, the full story of this complex lung injury is still unfolding. What is definitively known is that EVALI can cause devastating lung damage and, in some cases, prove fatal. For current vapers, vigilance regarding potential symptoms and a willingness to seek medical help are paramount. For those contemplating starting, the risks warrant serious reconsideration. As scientific research into EVALI continues, we can anticipate the development of improved diagnostic tools, more effective treatments, and hopefully, more robust regulations to safeguard public health. In the interim, staying well-informed and making health-conscious choices remains the most potent defense against this potentially devastating condition.